Welcome to the Optum Rx Pharmacy Insights Podcast. In this forum, we'll discuss the latest and most impactful events in pharmacy benefit management. In this episode, we will return to one of the most fiscally relevant issues for plan sponsors today, the arrival of biosimilar alternatives to expensive specialty medications. Today, I'm joined by Jamey Millar, Senior Vice President, Industry Relations, and Savitha Vivian, Senior Vice President, Formulary Management. Savitha and Jamey, welcome back. You've both been guests on prior episodes, but before we get started, can each of you remind our listeners of your background and what your responsibilities are at Optum Rx? Jamey, let's start with you.
Thanks, Scott. Nice to be with you. My background includes 30 years in the pharmaceutical industry, principally in commercial and market access leadership roles. Here at Optum Rx, I lead industry and network relations. I think for the purposes of this discussion, this important discussion, my teams lead the negotiations with branded manufacturers for price concessions, as well as the same with biosimilar manufacturers.
Thank you, Jamey. Savitha, can you speak a little bit about your background?
Sure. Thanks for having me today. Scott, I am a pharmacist by training. I have spent the last 20 plus years in the managed care arena with an emphasis in clinical services. So worked with our P&T committee, utilization management criteria, clinical policies, and is now in our industry relations space, managing formulary management and strategy. And in that role was responsible for defining and executing our biosimilar strategy with regards to Humira.
Great. Thank you, Savitha. So Savitha, if it's okay, let me start with you. Most people listening will have some familiarity with biosimilars as a concept. Can you give us a quick recap of why they're important?
Yeah, so biosimilar drugs are a primary driver of pharmacy spending. Biologic drugs are, we've talked about it in past podcasts. They're those complex molecules for rare complex diseases and are considered to be specialty drugs. And specialty drugs, while only making up 2% of all prescriptions that are filled, they account for 50% of drug spend. So a huge impact on plan sponsors and members in terms of drug cost. And what biosimilars are intended to do is that they encourage competition. Having more products on the market drives that competition, lowers price. And biosimilars, being similar in nature to these expensive biologic drugs, also maintain choice for providers and members by providing same quality of care at a lower price. So as we get more biosimilars that enter the market, again, it increases competition, leading to price pressures, savings for members and our plan sponsors, while maintaining that high standard of clinical care without any disruption to treatment. So what we saw in the last, 2 years now was the introduction of biosimilars to Humira, which was a top-selling drug of all time, which provided an opening to drive that meaningful savings in these high-cost specialty categories. And again, what we saw was the presence of the biosimilar competitors allowed to leverage our negotiating ability with not only the biosimilars, but also with AbbVie for better value on the brand Humira. So we leveraged the fact that there were almost a dozen biosimilars available, coupled with our formulary strategy to add up to 3 of the biosimilars on our formulary. And you can see how that created competition right away and drove down cost and provided that savings for our plan sponsors and members.
Jamey, at the time of this recording, we find ourselves in the fall of 2024. I think the availability of biosimilars for Humira, which is a medication commonly used to treat rheumatoid arthritis, psoriasis, irritable bowel disease, have really dominated the conversations with our plan sponsors. And I have 2 questions for you. I think number one, how would you describe the Humira biosimilar market as it sits today? And number 2, can you give us a sense of how you assess the merits of new biosimilars and the criteria that you use to help determine formulary selection?
Yeah, thanks, Scott. Relative to your first question, I think the market for adalimumab biosimilars is still evolving. The first couple of years were transitional in nature, and that was a function of the timing and sequence of the launches. If you think back to 2023, the beginning of the plan year, January, did not see a biosimilar. The first biosimilar from Amgen, Amgevita, launched at the end of January, early February. So asynchronous with typical plan year benefit design starts. And then you saw a number of biosimilars launch in a staggered fashion in waves almost throughout the year. The other component was the development programs of these biosimilar manufacturers continued to mature. So some of the non-clinical product features and attributes continued to develop over time. So, for example, not all of them were citrate-free or high concentration formulations. Some had interchangeability, some didn't. Some didn't have all the doses. So they continued to invest in developing out the product features and characteristics. And now, as we head toward the end of 2024, I think we've got a very mature product marketplace in terms of a settling out of pricing based on leveraged competition, as well as kind of maturity of these product features and characteristics as I described. So I think we're primed for a fairly significant shift as we start 2025, and our 2025 formulary strategy reflects that attitude.
The Humira biosimilars really gave us the first biosimilars of consequence within the pharmacy benefit. Considering what Jamey just said, Savitha, what lessons have we learned, and how will this impact the way that Optum Rx formularies will treat Humira and its biosimilars in 2025?
So what our biosimilar strategy for Humira was that Jamey kind of reviewed is we added biosimilars, 3 of them, which was Cyltizo, Hyrimoz, and Amgevita at parity with Humira on our formularies. And what we learned was that members and providers didn't really want to switch off of Humira to biosimilars at that parity position. So if given a choice to stay on Humira or move to a biosimilar, we didn't see a lot of switching, which I don't think was surprising. So I think one thing we learned is interchangeability, where the pharmacies can actually substitute the biosimilar for the innovator brand is important, so that those switches can happen at the pharmacy without the involvement of providers and members, especially when we're looking at a parity position. Another thing that we learned is, our clients have informed us that simplicity is something that's to be desired. So with 3 biosimilars on the formulary, the message kind of gets confusing on what's preferred, what's not preferred, which manufacturer is going to promote the drug. Our resources are kind of split out amongst three products. So for 2025, we're going from 3 preferred biosimilars down to 1 preferred biosimilar, which is both a high list price and a low list price version of Amgevita. And we feel like our choice in Amgevita aligns with our guiding principles, which is continued quality for care for patients by choosing an FDA-approved biosimilar. Amgevita will have FDA-approved interchangeability. So what I spoke of with the pharmacy assisting in moving patients off of innovator brand to biosimilars can happen seamlessly. We have stable supply in the Amgevita product. And also the Amgevita product provides the formulations and all the strengths that Humira comes in to provide that continuity of care. So there isn't anything lacking or a specific population that can't switch off of Humira onto the biosimilar. And lastly, ensuring that our selection in biosimilars continues to provide affordability, not only to our plan sponsors, but also to our members through $0 copay assistance programs.
Yeah, on the surface, these seem like significant changes. Savitha, you talked about the initial lack of movement of members off of branded Humira. How does the organization plan to bring providers and patients along to really embrace the use of biosimilars?
So, interchangeability was an important guiding principle in formulary selection, and we are preferring a product that has interchangeable designation. But we are finding that there is an exclusivity period that exists for other therapies that already have this designation. And so it may not allow the pharmacies to interchange automatically on January 1st when we put our new biosimilar strategy into place. So to ensure continuity of care, we're allowing existing Humira patients to be able to continue on therapy without switching until those preferred biosimilars are interchangeable without a new prescription. So I think the fact that we have chosen a drug that has that interchangeability status, and when that exclusivity period ends, we will ensure that biosimilar uptake is increased. Another is ensuring that patients are provided an affordable alternative. So we chose a product that has $0 copay assistance program. And then we're working with our plan sponsors to help them make the best decisions for their members. So in addition to that, we'll also be reaching out to pharmacies to help them prepare for the change and providing them the resources to facilitate the switch in terms of letting them know what the formulary alternatives are ahead of time, helping them with things such as the PA process and making that as seamless as possible for them. And then lastly, following all of this up with provider education and continued patient support. So notifying providers of when the changes are going into place, letting them know what the preferred alternatives are, helping them also through the PA process by ensuring PA approvals are already available for the biosimilar so that when patients transition off of Humira, they will be able to do that seamlessly.
Jamey, you and I have been in the industry a long time. I think the hope of biosimilars has always been focused, I think, on their anticipated ability to help mitigate specialty drug spend. For so many of our plan sponsors, specialty drug spend is over 50% of their total drug spend. What type of financial impact can plan sponsors expect through the adoption of Humira biosimilars?
Yeah, great question. I would say that even in the last 2 years, with the parity formulary position, we've delivered significant net cost savings for our clients, as has been the case with other example biosimilar introductions. The value that's extracted through competition comes not only from the biosimilar pricing, but also from the innovator price concessions that are required to maintain competition, should they choose to do so. So in 23 and 24, even in the parity formulary position, utilization of adalimumab occurred at a much lower net cost for clients than in previous years when Humira had an exclusivity in the marketplace. So as we look forward to 2025, as Savitha described, with the additional levers in terms of formulary actions, as well as pharmacist ease of conversion through interchangeability designations, we'll be able to extract, for clients, even greater net savings. Just to give you an example, the low WAC Amjevita product, low wholesale acquisition cost product, comes at a 83% discount to the list price of branded Humira. So our optionality continues in 2025, allowing clients the ability to choose a high WAC Amjevita with rebates or low WAC Amjevita through Nuvela at that low list price. So the opportunity is there for clients to seize upon the adalimumab availability and drive even further net cost savings.
Savitha, let me close with this. We focused our discussion on Humira. I want to broaden the discussion a little bit. We know that there are many other expensive biological medications. Where is the biosimilar market going, and what other drug categories can we expect similar approaches to with what we are seeing with Humira biosimilars?
Thanks for that question. So before I get to where the market is going, it might just be beneficial just to reflect on where we've been and where we're at. So first biosimilar was approved by the FDA 8 years ago. And in 2024, we now have 46 biosimilars available for 11 different biologic brands. So we're, some would say that's a slow start, but we're making progress, right? And in that time frame, we're finding that biosimilars now are on average 50% lower than the brand biologic products, and even lower, as Jamey said, in the case of the Amjevita choice that we've made at 83% off of Humira list price. So significant advances in the number of biosimilars and the cost benefits that they afford. So looking forward, we just went through Humira, which was one of the biggest biosimilar launches anticipated. What's next is more drugs in the immunomodulator space, so drugs for psoriasis, psoriatic arthritis, rheumatoid arthritis. So we're expecting the next big biosimilar launch to be the biosimilar for Stelara in 2025. In fact, we anticipate the first one to launch in January, followed by two others in February. We will see a biosimilar, hopefully, for other high-cost specialty drugs, such as Prolia, which is for osteoporosis. And then in the next two, if you look at even 2 years, we're looking at biosimilars for drugs for Crohn's disease like Cimzia, and then biosimilar for Trulicity, which is for diabetes. So many more that are still on the horizon. And again, I think with any biosimilar launch, we have developed what I think is a really stable, sound set of guiding principles to help direct our choice in which products to choose. And we'll continue to follow that and, revise that as needed as we find more information and go from there.
Jamey and Savitha, thank you both for participating in an enlightening discussion today. Thanks for listening to the Pharmacy Insights Podcast. I'm your host, Scott Drager. Tune in again for more discussions as we examine the most important issues in pharmacy care services.